4 years ago we launched Call to Action, which was part of a national campaign to look at how health services could respond to the financial challenges that we were facing and the changing nature of healthcare. We did that locally here with our neighbouring CCG in Shropshire. We culminated in a big conference at the International Conference Centre here in Telford. And we had some very clear messages from the public and stakeholders and clinicians about what they thought we should do. No change wasn't an option. They wanted care closer to home. Patients and clinicians wanted greater empowerment around decision making and around involvement. We came up with a clinical model which gave us a long list of options. That long list of options was then narrowed down with stakeholders to a short list, and we are going out to public consultation now on what we believe are the deliverable options, both from a financial sustainability point of view, but also more importantly from a clinical sustainability point of view.
The model we're proposing has services spread across 2 sites. One site will have the emergency centre and the women and children's centre, including the consultant delivery unit. The other site will be for planned care. Both sites will have urgent treatment centres, but the emergency centre will only be on one site. Our preferred option is the emergency centre is sited at the Royal Shrewsbury Hospital in Shrewsbury, and the planned care site is at the Princess Royal Hospital in Telford. FutureFit has taken 4 years to reach this point. The discussions so far have involved a lot of people. This is your opportunity to get involved and influence the process and give us as much information and thoughts that you have on our 2 options.
And a lot of people seem to be under the impression that this is only about money. It is not only about money. This is really about delivering safe, effective clinical services. We can't carry on the way we are, so something has to change. No change is not an option. It's clearly now much more effective to deal with life-threatening and limb-threatening injuries and illnesses on one site with very specialised staff and with a critical care unit.
The current situation in Telford and Wrekin, Shropshire and Powys in terms of emergency care is neither clinically nor financially sustainable. The split site working is incredibly inefficient, and the working conditions mean that we cannot attract the best clinicians that we need to attract for the future. Once the consultation is completed and the decision on the site is made, that is the point at which capital investment can start. That will mean capital investment in hospital buildings in both sites, irrespective of which option is chosen, which will be fundamental in attracting more doctors and nurses, which we currently have a huge shortage of. Both of those options, either option, increases outcomes for patients or improves outcomes for patients above the current provision.
We really want to hear from you, so please visit the website and tell us what you think.
So now is your opportunity through this consultation process to tell us how our proposals will impact on you. You can get involved by looking at the website, which is www.nhsfuturefit.org.
This is your opportunity. Don't miss it.
This is an important stage in the process for us because it's really important for us to listen to what the public have got to say here. You know, all of us use healthcare. We all use healthcare at some point in our lives. You know, I live in Shropshire. I understand how difficult moving around Shropshire is, particularly in those remote rural areas. And that's notwithstanding the issues in terms of Powys and how difficult it is for residents of Powys. So this is really important. You know, people have been involved up till now, but we really want to get as many responses as we can to the consultation. It's not about a vote, because actually that doesn't help us. This is about actually listening to what people's concerns are, how it's going to impact on them and their families, because we've got an obligation as part of the process at the end of public consultation to actually look at all of those responses and look at how we can either mitigate against them or make sure that we can put actions in place that address those. So it is really important that people go on the website, fill in the questionnaire, or do it on a manual basis if they can't fill it in on the website, because we really do want to hear from the whole of the population. This is really important. Please respond.